So we're here with Dr. Wigoda. We are following up on Michelle's consultation for her breast implants. Dr. Wigoda, can you tell us a little bit about what the consultation was like and what Michelle chose for her implants?
Sure. Michelle's a typical young, healthy lady who has A to B cup breasts and would like to be a little bit larger. Here in South Florida, it's very common to get breast implants. And so there's a few different things that we need to discuss. Obviously, what size she would like to go to. There's different types of implants. There's saline versus silicone implants. Generally, I put the implants underneath the muscle, but they can be put above the muscle. And then the last thing to really decide is through which incision are you going to put the implants. So with Michelle, she decided she wanted silicone implants. The silicone implants have some benefits, the main one being they're more natural in appearance and more natural feeling. The one downside to silicone implants is you need a little bit of a bigger incision to get them in because they already come filled, whereas saline implants are basically empty and then you put them in through a smaller incision and then you can fill them. So in Michelle's case, we're going to be going in her breast fold. The other thing with the silicone implants is because you need a bigger incision, you can't always put it in through the areola. It depends on the size of the areola. So in her case, we're going in the fold. She chose silicone. We're going to go underneath the muscle. There's also a lot of benefits to that. Again, they look more natural. They'll feel more natural. There's a little bit less rippling if you put it underneath the muscle, and there's less chance of getting what we call a capsular contracture, which is a scar that develops around the breast that can make the breast hard. So we don't see that often anymore with the newer implants, but that's just an additional benefit of going underneath the muscle.
Okay, so what is the procedure like? How long is it going to take?
The procedure takes, from the time I make an incision to the time I'm finished, it takes a little bit less than an hour. It's done under general anesthesia, so an anesthesiologist will put her to sleep. We'll prep her and drape her to the surgery. And then she wakes up, she doesn't feel anything, as opposed to in some places here in South Florida where they offer local anesthetic surgery for breast augmentations, which I think are absolutely ridiculous to do when you can do someone without any pain whatsoever under general anesthesia. But they do that because they're giving rock bottom prices, and obviously it's a little more expensive to have an anesthesiologist there putting you to sleep and monitoring you, which obviously is a much safer way to go and a much more comfortable way to go.
All right, thank you. Well, we look forward to the results of the surgery.
Great, thanks.